Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Post. One of the articles talked about the red flags of cancer that we should be aware of. Talk about breast lump, difficulty urinating, loss of bladder control, changes in bowel habits, cough, weight loss, abnormal skin moles, shortness of breath, rectal bleeding, blood in the urine, abdominal pain. These are things that are suggestive that you might have cancer, or you just need to go see the doctor about them if you have those symptoms, because they may be signs that you need to be investigated to have whatever is causing them treated. Then, of course, if you have any swollen lymph nodes, uh, suddenly you may feel them, or they may be tender or not. But if you have any mass that wasn't there before, should be checked out. Then, of course, any change in bowel habits, whether it's diarrhea or constipation, it means that you should have tested to be sure that you don't have polyps. And then if you lose 5 to 10 pounds unexpectedly, that's another sign that you should be checked out by your physician. And then if you suddenly have a chronic cough that you never had before, is another sign or symptom that you should see your doctor and make sure that there's nothing serious that's causing that new symptom. So those are signs and symptoms that alert you to the fact that you should check with your doctor to see if something's happened that needs you to be checked, and make sure you can have cancer detected early. That the essence of all of that is to get as early a diagnosis of cancer as possible so that it can be treated, since we've found new ways of treating cancer that we didn't have before. Any comments about any of those signs or symptoms that this article is alerting us to? If not, is there a question or comment? Not so. Okay. The second article is about the five.
Did you stop and get your pastry this morning?
The next one is 5 surprisingly hopeful things we learned about Alzheimer's this year. One is there's a new Alzheimer's blood test that looks at the signs of amyloid beta plaques, which may be a herald of Alzheimer's. We won't go into the benefits of early diagnosis of Alzheimer's other than to say that, with the family being alerted to it, you can try to protect your loved one from and yourself from dealing with that dreaded disease, which is very common. And in some circumstances, the number one cause of death in the world, maybe. Second, we learned that lifestyle interventions can lead to better cognition and perhaps even prevent you from getting Alzheimer's. So that's a second hopeful thing. The third is that there's been an increasing focus on inflammation as being one of the triggers for Alzheimer's, and so that the anti-inflammatories medications, even the GLP-1s and others, may well be the way to overcome this uh, dreaded disease, Alzheimer's. And then we've identified that some of the vaccines are associated with reduced Alzheimer's rates. So that's hopeful, especially RSV virus vaccine. And then finally, a number of recent articles are pointing out the role of lithium in the treatment for Alzheimer's, as well as for management of other types of mental illnesses. Lithium, which is a relatively cheap intervention, is something that has been rediscovered. It's an old drug, but it's rediscovered as a treatment for mental illness, as well as for the symptoms of Alzheimer's. So anyway, those are the two articles that I thought I'd bring to your attention uh, as we start off this program. Any comments or questions about any of the things we talked about?
Can you hear me?
Yes.
Okay, I had going back to the first article from the post that you read. Um, could you say that it's you listed so many different symptoms that it seems like comorbidities in general can be a sign of cancer.
What did you say? That word,
Comorbidities,
oh, comorbidity.
yeah, in general, could be a sign of cancer, and not necessarily any of the things that you listed. You listed quite a few things, but you listed them separately.
Right,
And so,
right. All of
go
them
ahead.
can be signs of disease, right? But they also particularly could be signs of cancer. Any other comments? Uh,
John, I think your phone is echoing.
what's that?
John, I think your phone is echoing.
Yeah.
Okay, okay. I'll turn it off. Were you able to hear the question all right?
Oh,
Yes.
yes.
Yeah.
Okay. If-
John, okay.
Yes.
Yeah. Good morning, Dr. Callender and everybody. The lithium you were talking about, is that just a regular over-the-counter drug?
No.
Oh, you have to get it
Get
from
a
your,
prescription, right?
okay. Thank you.
Okay. If no comments or questions, let's go to the first article. And this is an article that is indicating that COVID is with us and is uh, having periods of surges and ups and downs. And as we had talked about for some time now, most states have their own ways of making COVID-19 vaccines available. And most of the giants in the CVSs are heralding the fact that they have COVID-19 vaccine. So it is not that it's not available. It's just that sometimes the uh, Kennedy and his group making it appear to be difficult to get it, but it's very much available. And of course, most of the advice is that the COVID vaccine every 6 months or so is probably the best advice. And of course, we're now in the season where the flu vaccine is as well appropriate to be administered. It's good. I think many people think it's that COVID-19 vaccines are not available, but they actually are available. You just have to uh, go to the pharmacy to get it, or if you have any need, you can go to your physician and ask them to order it for you. Uh, but it's available, and it's advisable to get it. Darryl?
Yeah, I got got my flu and COVID-19 shots yesterday. I had an
Good,
appointment to
wonderful.
do it, but the pharmacist told me that they just accept walk-ins, so you don't need an appointment.
Right. And I think that's common. That Kennedy makes it appear as though you have to do a lot of other things, but most of the pharmacies are heralding the fact that they've got the vaccine are willing to give it to you.
My appointment is today, this afternoon, for a flu. I've already had my COVID.
Hey, and the thing about this COVID is that it's often starting now with sore throat more than it did before. But here's a laundry list of all of the ways it presents itself. Any other comments or questions about this? And remember again, those of you over 65 get the double dose, which is available for the flu. Yeah. Right.
So our area has very high levels of COVID.
Yeah. Okay, let's go to the next article unless there's some questions or comments about this one. Yeah, this is an interesting article where it talks about getting sick and oh, hold on, I have to answer the door. I'll be right back.
And this is a 19-year-old college student. Can you imagine this?
Now I had a flood in the house last night, so we were coming to try to fix it. So I apologize. So this is a teenager who was found unconscious and was diagnosed with meningococcal septicemia, which led to her requiring her to have loss of her fingers. And it's a tragic case, but she was able to survive. Meningitis meningococcal septicemia is disease that has caused many lives, and she was able to survive. Wonders of modern medicine. You wonder why she required amputations, but often when you have infections like that, they give you medications to keep you alive. And some of these medications have a side effect in which they compromise your circulation to the hands and the feet. So the lack of blood flow is associated with sepsis and required her to save a life to take off her. To have amputations. It's not common, but it's something that occurs. This is a case in England, but it occurs in the United States as well. Hey, Darryl?
Yeah, it's such a shame. She was trying to self-diagnose herself, like I think I got the flu. And boy, was
Yeah,
she wrong. But it's just a cautionary tale that when something is wrong, go see a doctor. It's not just the kids that are guilty of it. A lot of us adults will let problems go on for a period of time without seeing a doctor, where it could be, tragic, just like this teenager.
hey, could you all of you hear Darryl?
Oh yeah. Oh
Okay.
yeah.
Okay, let's go to the next article.
Question, how do you come in contact with this type of bacteria? What cautions can we take to so this would not happen to us? Are there any?
I don't know that there are any. Um, yeah, I don't really know there are any because meningococcal meningitis is contagious, and I don't know how you can avoid contact with people who have it. And, um,
Okay,
the
thank
only
you.
thing I can suggest is if you have any headache or any symptoms, often headache may be one of the early signs of meningitis. But I don't have any other advice as to how to prevent from getting uh, meningococcus, except they do have a vaccine for it.
Thank you.
Any other comments or questions about this dreaded complication, which tends to affect younger people and affect the students in colleges? But I wish I had other advice and recommendations, but I don't. Drug-resistant bacteria are becoming more and more common because of the fact that we tend to use antibiotics inappropriately. And the recommendation is that antibiotics should only be used when necessary and not empirically just because you think you may be having a cold or something. That viruses do not respond to antibiotics, but when antibiotics are used without appropriate indications, then you have drug-resistant anti drug-resistant bacteria which don't respond to the conventional medications. And what that means, if you get those, that the medications we use will be ineffective at curing you. So you're likely to die. And so one of the things we have to do is to try to use antibiotics when there's a bacterial infection and not otherwise. The occurrence of drug-resistant bacteria is becoming more and more a problem, as you could see in the introduction to this article. They've increased by close to 70%. A lot of it is thought to be related to inappropriate use or misuse of antibiotics.
Dr. Callender, hand sanitizers considered antibiotic?
No.
Okay.
Any other comments or questions? If not, we'll go to the next. Darryl.
Yeah, some of the antibiotic resistance may come from eating meat, well, not just meat, but eggs and dairy, because National Institute of Health says that antibiotic residues remain in those food products even after heating, after you cook them. Um, the amounts of antibiotics is regulated by federal law, but there's still residue in your some of your food products if you're eating conventional meat, poultry, eggs, dairy. So that's one of the reasons I'm a vegan. So I avoid that antibiotic resistance that could be built up in eating those food products.
Thank you for sharing. Thank you. Okay. This is an article that talks about the bias that people who are overweight experience when they go to a doctor's office. Talk about the fact that the chairs may not be appropriate for those who are overweight. Blood pressure apparatus may not be appropriate, and that there's so many ways in which people who are overweight are subjected to a bias against people who are overweight. Of course, they bring up some other issues that really don't have anything to do with obesity. Hypertension, diabetes, hypercholesterolemia are disease entities that are also associated with being overweight. But it's difficult, being overweight, to not be overcome by the ways in which you face bias when you go to a doctor's office if you're overweight. And this bias is something that's ever present in the physician's offices because they cater to people who are not overweight. Not to say that being overweight is healthy, because it isn't. And steps should be taken for you to not be overweight. So it's not that we're saying overweight is good for you. We're just saying that when you're overweight, if you go to the doctor's office perhaps could be more friendly to those patients who are overweight. And this article talks about ways in which that could be done. Any comments or questions about the interesting effort to try to overcome the way in which patients who have a BMI of greater than 30 are subjected to? Still, obesity is still not treated as the disease it is, because it's an inflammatory disease, which sometimes people just look upon it as an infirmity that you need to eliminate, which is true. It's unhealthy, and the extent to which you can lose weight and be normal weight is desirable. the treatment of choice for it is still a question of whether you want to have bariatric surgery or medications. Any comments about Betty, Leila?
Yes. I've always thought that the stigma is more on obese women than on obese men.
Well, obese women are healthier than obese men. Obese men really uh, are worse off than obese women. You know, it's interesting that we talk about a big belly will kill you, but we don't. When we say a big butt will not. Uh, so yeah, it's interesting. The biases are there, but obesity is obesity, whether it's male or female.
Yeah.
But the observation is true, is that more people talk about it as it relates to women than to men. But it's deadlier in men. Any other comments? If not, we'll move on.
Is there any particular things that men can do to get rid of their belly, the fat?
Well, people talk about exercise. And of course, pushing back from the table is one of the greatest exercises. But they have abdominal exercises that they recommend. But I think, um, Dale, you have any special exercises that you think are particularly good for that? Yeah. I'm sorry.
Oh, was he asking me?
Yes.
Well, I got to wait
Yes,
till he
he was
comes back.
asking you.
Go downstairs.
All right. Well,
He was asking if you have any special exercises for
oh,
belly
absolutely.
belly fat.
What?
Yeah.
Thank you. Yeah, thanks for the cleanup, my friend. Appreciate it.
That's John.
Yeah. Number one exercise I would recommend for losing a big belly is push-ups. Push up away from the table.
I've heard that.
The table. The greatest exercise of them all.
My husband is asking the question because he does have a big belly. So,
Yeah.
but he laughed when you said push away from the table. So he's
And that's the greatest
not quite
exercise.
ready to do that.
Okay. This is an article that talks about the correlation of being overweight and having varicose veins, and how it is more common with varicose veins, of course, dilated vessels that can lead to thrombophlebitis and other complications and cause blood clots. But often it's particularly in women, it's something that they have surgery on because they want their legs to look less, more beautiful. That's the way you put it. And of course, one of the ways of addressing it is by wearing compression stockings, which increase the venous return, which is compromised by having varicose veins. Pressures, compression stockings is sometimes one of the ways that minimizes the impact of varicose veins. And here again, men who have varicose veins tend to just put on compression stockings, whereas women are more likely to have surgery for varicose veins. uh, than men. Although, John Buchanan, you had a question?
Yeah, I didn't mean to interrupt, but I hear, I see on these commercials about copper fit socks. And do you have any, is there any medical, real true medical benefit for copper in these stockings that they have supposedly to?
I don't know of any. Compression stockings are definitely recommended. Whether you use copper or not is not. We don't. I don't have a medical justification for that, but certainly compression stockings are recommended and are very valuable in terms of decreasing the swelling associated with varicose veins.
It's just amazing to me how uh, so many claims show up on commercials that, I mean, you know, you could say whatever you want if you got the money.
Yeah, so true.
Pay for the article. I mean, the advertisement.
But these recommend these 5 recommendations here are very good ones.
Well, I don't know about compression stockings. I've never tried that. But every night I sleep with compression gloves that have copper running through them to deal with my carpal tunnel. And I mean, I do it consistently. And since I've been doing it for over a year, I haven't had any carpal tunnel symptoms.
The most of the disadvantage of the varicose veins involves the lower extremity. Um, but these are good recommendations in terms of decreasing the signs and symptoms of varicose veins, which we talk about in the lower extremity, the legs and the thigh. Okay, next article, please. Uh, we tend not to associate obesity and metabolic factors to the higher risk of asthma, which is a condition that is far too common in the United States. But they are linked to higher rates of asthma. Asthma, of course, is a condition that particularly is bothersome to people of color, uh, and is associated with uh, increasing the atopic or the allergic population. It's a manifestation of allergies, but it is associated more with people who are overweight. It's one of the conditions that has a high association with mortality at any age. There are many articles. This is in China, but there are many articles in the United States that address the high incidence of asthma in people of color, and the burden of asthma is particularly problematic in our population. And its treatment, its avoidance is one of the hardest things that you can do with children, and um, so many deaths from asthma every year. Any questions about asthma? If not, we'll go to the next article. We're talking about if you don't sleep enough, you eat more and you gain weight. And so getting 7 to 9 hours of sleep is a very important way of controlling obesity. The less you sleep, the more you eat is the correlation. Association with increased insulin insensitivity is one of the ways that insomnia contributes to the problem. Any comments about this? Um, Darryl?
Yeah, many seniors find it real hard to get a good night's sleep because of things like nocturia, getting up to pee at night. And even when you don't get up to pee at night, when you don't get enough exercise, you may not feel like sleeping that full 8 hours. But just some of the tips, like what Betty, she doesn't eat after 4 o'clock. Isn't that right, Betty? I think she's nodding. Yeah, but when you do snack at night, you find yourself drinking more to wash it down. And so it's also a good recommendation to stop drinking fluids after 6 o'clock in the evening. That way you have less tendency to get up to pee at night. Um, there might be some vitamin deficiencies that cause you not to sleep as well. So check out if your magnesium levels are low, because if they are low and you take magnesium with the last meal of the day, that could promote very restful sleep. A very minimal dose of melatonin, like 3 milligrams, may make you sleep like a baby. And when you do sleep well, you feel great.
Thank you for sharing, Darryl. Betty?
Yes, yes, I definitely was on the diet of not eating after 4. I've kind of gotten away from it a little bit, because my weight is now, just weighed before the session to this morning, and I weighed 144. So I had wanted to get down to 150. So I'm not sticking as much to that diet, but I just have bad eating habits anyway. So, and I definitely, after working 30 years at night, I'm just not a great sleeper as far as going to bed and sleeping 7 or 8 hours or whatever. I've always broken my sleep up because I had to do stuff. So I'm really not a good person to to model after anymore, because I eat when I feel like it. Sometimes it's 12 o'clock midnight and I'm still eating or drinking something. So where I've lost the weight that I wanted to lose, and I'm still not eating as much, and I'm trying to keep it down, but my eating and sleeping habits uh, are not good at all. So I need to improve on that.
Thank you for sharing. Any other comments? If not, let's go to the next one.
Betty got me hooked on potato chips.
Let's go to the next article.
No, I didn't.
Yes, you did. You were talking about them so much, and then man, they got tasty.
This is an article about oral GLP-1 drugs, which now are available, and the FDA has now approved oral GLP-1s. Initially, they were available by injection. Now they're available. FDA has approved them for oral administration, which will make it easier for those people who don't like to take injections. But it's just as effective, apparently, orally as it is by injection. As we talked many times over the last year, that these are the wonder drugs of the 21st century. So it seems to be affecting almost every organ system. Any other comments about the new FDA approval of the oral hypoglycemic, I mean GLP-1 drugs? When we say that they were approved for the treatment of diabetes, they weren't approved for other indications. So now the oral drug is now approved for uh, diabetes as well as obesity. Go to the next article. This is another GLP-1 drug that lowers the A1C as they were initially used for diabetes, but they also lower the hemoglobin A1C and also uh, uh, lower the BMI, which we know for adults, but this is demonstrating that this is true as well for children. And with childhood obesity becoming an issue, the role of GLP-1 drugs in the management of morbid obesity in children is important to appreciate as well. We often talk about the type 1 diabetes in children, but not so much the type 2 diabetes, which may be associated with obesity as well. So it's important to recognize this in your children and grandchildren, great-grandchildren. You have a drug that addresses the obesity and the diabetes at the same time. Not a whole lot is talked about the mild to moderate gastrointestinal side effects of these drugs, but for the most part, as you get used to the drug, the GI side effects become easier to deal with. As Dr. Perez had mentioned many times, we still need more studies to look into how these drugs interact, particularly with people of different ethnic groups. If there are no other comments, we'll go to the next article. Now, very little has been talked about the effect of GLP-1 drugs on the sexual drive. And this article suggests that this is a side effect that is little discussed, but is something that should be recognized, and that it may have a dampening effect upon the sex drive, and that as a consequence, we should be more sensitive to looking at the presence or absence of changes in libido or the sexual drive as a consequence of the use of these medications. This has not been studied particularly well and is a subject for much research since many of the antihypertensive drugs were eliminated because of their impact upon decreasing the sexual drive. So far, there haven't been a lot of studies that have looked at, even though we know that it decreases decreases the amount of drug addiction. We also need to look at its impact upon sex drive as well. Any comments or questions about this?
Is did the article say that it revved up alcohol use or reduced it?
It reduces.
Reduced.
Reduced addiction. It
Okay.
reduced addiction, alcohol and other addictions.
Okay.
But we haven't really looked carefully at its impact on sex drive,
Okay.
which is an area that is, of course, important. It's a wonder drug, it acts on everything, so it's interesting to look at all aspects of this drug in the short as well as long-term use. No comments, we'll go to the next article, although it's an important article to point out that we need to look in this aspect of it because we've looked at all other areas. This is another area that needs to be looked at as well. This is a very interesting article which talks about the fact that there are drugs like anti-thymocyte globulin, which is used in transplantation, and that this drug may decrease the death of beta cells, the cells that produce insulin. Of course, type 1 diabetes is associated with little to no insulin, and the fact that this anti-thymocyte globulin could increase the number of beta cells is an interesting hypothesis that the study of which in Europe has led many to believe that this will improve the management of type 1 diabetes by using anti-thymocyte globulin, which is well known for reversing rejection and transplantation. But as we know, the type 1 diabetes is associated with little to zero insulin produced by the beta cells of the pancreas. And so if this drug would increase beta cell insulin production, this would lessen the need for insulin. So this is a study that's done in Europe, but it hasn't been repeated in the United States. But it's actually food for thought because they have identified this drug. This drug we all already use for transplantation, but haven't used. It was always thought that type 1 diabetes is an autoimmune disease in which the beta cells of the pancreas are no longer capable of producing insulin. This study suggests that this kind of new treatment, new use of this drug would increase the amount of beta cell producing insulin, which is the first of its type, and so it'll take time to see if this really works out or not. Any comments on type 1 diabetes and a new treatment for type 1 diabetes, anti-thymocyte globulin? Okay. This is an interesting article that talks about having a healthy diet along with getting enough sleep will decrease the risk of heart disease. This is not something that is new, but it's something that is reemphasized so that heart healthy diet along with exercise and sleep. They added sleep to those elements that reduce the risk of heart disease recently. So all of these together decrease the risk of heart disease. Any comments? Not actually, none of this is brand new, but it also talks about the interval issue that we talked about a couple of weeks ago being involved as well. And as John has outlined, the sitting as the new smoking is something that we need to minimize and decrease because it is one of the least healthy practices that we have in the day is sitting. Working out is one of the best, sitting is one of the worst. Interesting analogy that they equate sitting with smoking. So how much sitting do you do, and will it compensate for all of the exercise you do? You won't if you sit too much. So exercise more, sit as little as possible. It's easy to say, hard to do. Betty?
Yes, it also says that doing your housework and stuff like that helps. It sort of balances it out. Somewhere, one of the paragraphs said something about your normal routine around the house.
Yes. Mm-hmm.
So
Right.
my husband was mocking me saying, yeah, if you sit, because he does know I sit in front of the computer a lot, but I also do a lot of housework. So
Okay.
Also, grocery shopping. It's good exercise.
Yeah. Yeah. Right. Good. Good. That idea of squatting while you brush your teeth is interesting. Taking the stairs instead of the elevator as well. So, yeah. Okay. We had an article last week about holly pills for cardiovascular disease, and but the fact is that one of the barriers to polypills, of course, is presence absence of health insurance. And since in the United States we don't have a health as healthcare as a right for all Americans, polypills is an issue that uh, creates disparities because if you have enough health insurance, you can get your medications. If you don't, then you won't be able to afford the medications. And therefore, polypills is not something you'll be able to afford. So the disparity, of course, one of the things that we mentioned last week is that what the new administration is doing is to eliminate the disparity by eliminating looking at ethnicity and gender. And when you do that, you then eliminate the fact that there is a majority-minority disparity because you don't look at ethnicity, you don't look at so-called race/ethnicity, you don't look at gender. So how then are you to identify disparities? You won't be able to. And so you will then say that there are no majority-minority health disparities, which of course is a lie. But anyway, that's the latest development that we're aware of. Nobody's announcing it, but it's what the administration is actually doing. They're taking away all references to race, ethnicity, and gender in the data. So in many ways, we have a very dangerous administration right now. John Buchanan?
Two questions. One, what are polypills? What does that mean?
That means that you take a lot of pills.
And the
So if you're
other,
taking more than 2 or 3 pills, that's polypills.
oh, okay. And the other is why, boy, I lost my train of thought there. Yeah, these medications they're talking about having oh, cardiovascular disease, right?
Yes.
CVD. All right. Um, these other countries seem to have a leg up on prescribing these kind of medications. Why don't they do it in the United States?
Well, we've had this discussion many times, but universal, these, for other countries, healthcare is a right. In the United States, it is not a right. You don't have universal health care. In other countries, they have universal health care where everybody is covered, whereas in the United States, we do not have it. Why do we not have it? Because we have decided not to do it. Obama brought Obamacare, which is the closest thing to it. Of course, for kidney disease, we have universal health care, but for nothing else. And so while the World Health Organization says health care is a right, uh, in this developed country, health care is not a right. And that's why not demonstrating or eliminating race/ethnicity and gender from data collection is to me is criminal because what you're doing is you're hiding the fact that you have a majority and minority health disparity because you're not collecting data on any of it. So you say it doesn't exist because we aren't measuring it.
And one last thought. While we're on this session for an hour and a half, maybe we should stand up for half of it.
I think it's a good idea. It's a very good idea. Okay, any other comments about the fact that we're the only developed country that does not have healthcare as a right.
Dr. Callender, you're saying that poly pills just mean you take a whole lot of pills. What about people who take their regular medication plus other pills? My husband is a diabetic and he does have a lot of pills that he takes, prescribed by his doctor, but he also takes Omega XL and Allegra D. No, just Allegra, not Allegra D, and other pills. So does that have any effect on his regular medication that he's taking?
No, but they all fall into the category of poly pills. I mean, that you're taking. Some people would say that poly pills when you're taking more than 5 medications, then that pretty much qualifies as poly pills.
Okay. So do you think the Omega XL, have you know of any studies that is done on them or?
There are many studies that have looked at the Omega products and they think they're anti-inflammatory, which is a good thing. So there's no reason not to take them because they're anti-inflammatory, which of course most of the disease entities, including obesity, are inflammatory diseases. So taking anti-inflammatory medications seem to be sensible.
Okay. Yeah, he says they help, so.
Yeah, I would think so, because they're anti-inflammatory.
Okay. Thank you.
Any other comments on this? This is a article that talks about the fact that when you get older and you have heart disease, that they want to do stress tests in all kinds of ways, and that when you get to be in the 80s, that sometimes these people who have multiple blocked coronary arteries may require catheterization or may require coronary artery bypass surgery. But the recovery may be long, and the question is for a person who's in the 80s, is it worth the risk? And can less intensive medications be more desirable than open heart surgery? And so this is an article that suggests that when you get beyond the 75-year mark, that maybe the cardiologist should be talking about how to avoid the more intensive stress tests and actually treat you with medications that are more beneficial in the long run than open heart surgery and cardiac catheterization. So this is a long article, but it's an article that is valuable in terms of appreciating that for the patient who's in the 80 to 90 age group, that sometimes the less intensive therapy may be best. John Buchanan.
Yes, is this just for people that have heart conditions, or is this for all seniors? 75?
No, just for people who have heart disease and who have chest pain. And so, but people who have chest pain, they usually do stress tests, and they often will do cardiac catheterization. And this article is suggesting that There are other interventions for people over 80 that as beneficial and maybe more desirable for them, but it's primarily those people who have chest pain.
And what is catheterization?
They
Is
put
that-
they put a catheter into your blood vessel and thread it into the heart, and they look at the coronary arteries, and usually associated with very few complications. But as you age, the blood vessels are thicker and the calcifications are more intense, and so complications can occur. And they're suggesting that maybe for those older patients, medical interventions are more desirable than the stents and the open heart surgery.
So but once again, what is a catheter? What does that mean? What does it do?
That's what I said. You put a catheter in the blood vessel, it goes into the heart, and they then take pictures of the coronary arteries. They identify whether you have a blockage in the coronary arteries or not. If you have a blockage in the coronary arteries, they may want to do a stenting where they put a stent in, or they may want to do open heart surgery to open up the blood vessels that may be clotted that caused the heart attack. So
So,
cardiac catheterization is a process by which you put a catheter into the blood vessel and access the coronary blood vessels, coronary vasculature. And the coronary vasculature, the blood vessels of the coronary are the arteries that supply blood to the heart. If you don't have circulation to the heart, you have a heart attack and your heart muscle dies.
okay, I understand that. My question is exactly what a catheter opens the blood vessel. Is that what it does?
No, the catheter just takes a picture. They take
Oh,
pictures of the blood vessel and
oh,
they see if the blood vessel is clotted or not. If
okay.
the blood vessel is clotted, they may want to put a stent in to bypass the blockage of the blood vessel. Or they may want to actually operate on the blood vessel and open it by means of surgery. So there are two ways of doing it. One is by uh, putting a stent in to keep the artery from being clotted, or by actually replacing the vein, opening the vein and recirculation, occurring recirculation. So the coronary catheterization is a mechanism by which you're able to visualize the coronary blood flow. And the coronary vessels are the vessels that supply blood and oxygen to the heart muscle. And without that oxygen and blood, the heart muscle will die, and that's what happens when you have a heart attack.
Thank you very much.
Okay, any other questions about it? Betty Blaylock?
Yes, I was just looking and they were saying that over 80, that they prefer maybe to do something other than the open heart surgery. But I thought about my mom. I know she was in her 80s when she had her open heart surgery, and she had two blockages, I believe, and she lived to be almost 98. So she lived another 10 years, I know, from the time she had her open heart surgery. So,
Right, right,
you
right.
know,
So that's a good example.
yeah. So if they had not wanted to do it, she might not have made that age.
You're right, absolutely.
Yeah. Yeah.
Good, thanks for sharing.
Mhm.
Any other comments? If not, this is an interesting article that points out that 64% of the United States adults have risk factors, so that most of the country has cardiovascular disease. And as such, the importance of taking medications for cardiovascular risk factors becomes important, as well as Darryl would say, preventing having cardiovascular disease by having the right diet and the right exercise and the right lifestyle, meditations, etc. An ounce of prevention is worth a pound of cure. And so hence he has adopted the vegan lifestyle along with the other healthy ways to avoid the risk factors that nearly 60% of more than 60% of the country has as they age. So we are a particularly unhealthy country. So we need to do something else. I think there's another article that we'll come to that shows that because of our lifestyle, we have cancers in the elderly. But what we're seeing now is that there's an increase in the rise of cancer in the young, and it's related to many factors, including the ones we've just discussed. Any comments or questions about that article? Because I think it's a very important one, pointing out the fact that we have so many comorbidities that an ounce of prevention is worth more than a pound of cure. There are no more questions about that. We'll go to the article of physical frailty, indicating that when you have frailty, which is weight loss, exhaustion, physical inactivity, slow walking speed, low grip strength, that you are more likely to have dementia. And so staying healthy, staying active is another way of preventing dementia. And so it's important to continue to do all of those things that we talk about that commensurate with good health, healthy diet, exercise. As John Buchanan said, less sitting, more standing, more activity. All of that avoids the frailty that goes along with inability to do those things that make you not frail. Weight loss, exhaustion, physical activity, slow walking speed, and low grip strength, all are ways that manifest that you are frail. And frailty then contributes to dementia as well. Any comments about this? As we do all we can to prevent frailty. Let's go to the next. Trump is maybe many things. He's not a physician, but he certainly has a lot of ideas about medicine. And most of his ideas they conflict with what the medical scientists believe. We know about some of his ideas in terms of treatment for COVID and other things, and none of them conform to what the medical experts agree. He alleges Tylenol causes autism. The doctors do not agree. He talks about other things that he has beliefs on, but are not shared with by the scientists and the doctors of the day. So he and Kennedy are kind of standalone health experts by their own designation. But most of the scientists and doctors disagree strongly with many of the things that they are saying today. So we have a lockdown now because the Democrats are refusing to bend on health care, and as a consequence, people will be without jobs for days, maybe weeks, maybe months, and John Buchanan, you're on mute.
It sounds like a lawsuit to me for anybody in government to pinpoint a specific uh, drug or specific reason for death or disease that's not justified. It's not, it's not based in science. It's based on theory. And, it sounds like a lawsuit. Sounds like Tylenol producers could sue the president for that.
Well, he's got enough lawsuits. He doesn't worry about lawsuits. He's got so many of them. Yeah. So, any other comments? Most people would agree with you, John. Many would say he far oversteps his bounds, but that's been the case. And in spite of it, he's president of the United States. So. And we've got a lockdown partially because of it. Any other comments? Okay, this is skin cancer burden in older adults expected to rise through 2050. Actually, what is even more disturbing is the fact that cancer is becoming more common in the younger patients. Expecting it in the older population is not as much of a surprise as the increase in cancer in the younger population, suggesting that there are many things that the younger population is doing that is contributing to the increase in cancer. So the increase in skin cancers in the elderly is not as surprising as the increase in cancer in the younger population is, which suggests that many of the things that we're doing are contributing to the development of cancer and other diseases. Now we know that for the most part, skin cancers are related to ultraviolet light that occurs from the sun, and so sunscreens and sunglasses and caps protecting from the sun can go a long way to decrease the skin cancer rate. Early diagnosis of skin cancer treatment, 99% of melanomas survive if they're treated early. But when it metastasizes, it's only 35%. So, any other comments as we look at the fact that as time goes on, we're getting less and less healthy?
And I wanted to say that to remind folks, I mean, a lot of people think that Black people don't get skin cancer, but that's a lie. We can get it, maybe not as much, but definitely we can get skin cancer, and we need to use sunblock if you're out in the sun a lot.
Thank you for sharing. Any other comments? Okay. There's an article that talks about memory decline as a natural, inevitable consequence of aging. Uh, However, there are many, as we know, we have personal experiences with Tatum's who their father and uncle, uh, well into their 90s and hundreds, were able to exercise and swim and do all those athletic endeavors and have mental capacities that were extremely great. And so the question is why? Why is it true for some and not for all? And the truth of the matter is we don't really know. Um, Although it does appear that the more socially active people are, the better off they are. And the more you volunteer to help others, the better off you may be. But yeah, the lifestyle may be a factor, but we don't really know. We have people who violate that, who live to be older, and we have people who don't. Uh, uh, it's thought that there's a difference in the size of the cortex, but we need to do more studies. As you see, the hippocampus and other parts of the brain uh, seem to not atrophy. Atrophy means that size diminishes, and this becomes more likely in those who are not super ages. But we have many more questions than we have answers in terms of what makes one at 90 have a good mental function, and another one has dementia and the other doesn't. Why? We don't really know all the answers. So we have many questions, very few answers. Any comments or questions about it? It appears to me that as time goes on and as we're able to map out the brain and all of its sections and subsections, that we may be able to, with time, get some more answers to these questions that still remain unanswered. But it's going to be a while.
And Dr. Callender, the situations that we're going through now with the social change and the economic change, it seems like that will also have an impact on our health and our general health conditions because of the strain that we're going to put on ourselves because of economic. We may not have the money we need to do what we need to do with the closeout, the closing of the government, and the stress it's going to add to us. So, will this be a contributing factor to our health conditions being on a decline?
I think so, but time will tell. I mean, we last had a closure of this during Trump's last presidency in 2018, I guess it was, and uh, we did have we survived it. The question is, what was the impact on our survival? And time will tell. I would suggest that your empiric thoughts are right on target, but time will tell because it depends on how long this is going to be. Is it going to be a month, a week, 2 months? What is it going to be? We don't know. Betty Blaylock?
Yes, he, well, the last time Trump was president was a lot different from the way it is this time. This time is much more stressful, and everything was still in place for us checking things out. But now with Kennedy as the Secretary of Health, all the research and all the studies and stuff are not going to be done. So we probably will never know the total impact of what's happening now.
Thank you for sharing. Any other comments? If not, let's go to the next article. This, uh, this will be the last one, and this is an article that suggests that the CT is not without its problems. That we get CAT scans, but getting it for pregnant people and congenital abnormalities is risky. This suggests that miscarriages and ectopic pregnancies and stillbirths uh, rose 14% with that and 90% with 3 or more screening, suggesting that radiation exposure has its complications and side effects for women who are pregnant. And as such, this is important to recognize that if you can avoid getting a CAT scan on pregnant women, it's desirable. We don't know all the answers to this question, but this certainly makes us think twice about getting CAT scans for pregnant women if you don't have to get them. Yeah. And so I think this will be the last article. And any comments on this? Okay, well, thank you for joining us today. Had a lot of discussion on a number of issues. Any closing comments you want to make with that? If
Well, I'm
not,
so
we'll see
sorry to
you
hear
next.
about your flooding, Dr. Callender. So I hope you get everything straightened out.
Yeah, well, yeah, I tell you, if it's not one thing, it's another. So keep me in your prayers. Thank you very much. Okay, see you next week, God willing. Bye.
Bye-bye. Be safe, everyone.
Okay. Thank you.
Hier bevlogen.